on the Cadillac a little bit to stretch that out. And then you would go through the heels, right? Your same foot series, same emphasis. You're going to do all the positions, but you're constantly thinking about what's going on in here. All right? Let's jump into arm circles. So, arm circles, is it better to have them strong, heavy, medium, or light? Or super light?
Light to medium.
Light to medium. All right? Slide down so your shoulders aren't touching. There you go. Perfect. Right there. Now, why is this? Yeah, exactly. Why is this good for the hips? Because he's got to hold them up, right? He's got to hold them in this position. Okay? Again, here's probably where I would use a block. Okay? Because I don't want him externally rotating the hips to hold himself, but I can't put his knees together either. I want a good position. So I'm going to reach down here and make sure I have a block or a ball. The blocks are a little bit better because they're going to fit at a good angle between his legs. The other thing is you want it distal on him. You don't want it deep, because if he pulls, thinks of pulling his knees together, it's kind of like the old, basically it becomes a lever. I think of a walnut. You follow me? The more I pull, the spring, or when you're cracking crab, right? Don't they have little springs on them so they don't smash, they kind of pull away? Kind of same thing there. So we're going to put it on his knees. I'm going to assist him to pull up, and he's going to pull the arms on down to his side. Good. Now, he's going to bring the arms up over his shoulders, trying to get that shoulder stability. Wow, we got the block in, so I'm going to have to change something. Pull on down. I'm going to hold on to the block. Come up. Pull on down. And come on up. Now I'm going to step away.
Do you want him going that low, or right now you don't care?
I would probably start stopping him before that. Tell him not to touch the table. Because you can see how his shoulders roll forward as the hands come down. So we'll stop about mid-thigh. Right there. Perfect. Now relax your shoulders away. There you go. Don't arch it though. Do you see how your ribs arch? There you go. Just relax them. Bring the hands up over the shoulders. And then pull back down. And back up over the shoulders. Now I'm good with his leg position. It is drifting a little bit away into extension. Can you guys see that? Or away so that his hip flexors are his main puller. Keep calling down. I might bring him in just a little bit or try to help him a little bit. I don't want him bringing his knees into his chest. Come up. And pull down. Come up. And pull down. Out to the side. Reach out wide. Pull back in. Reach out wide. Pull back in. Reach out wide. Pull back in. Up in front. I'm going to take the block out. I'm going to have him pull down, extend his legs. Pull down, lengthen those legs. And come back up. Now I want you to stop again, same place with the hands as we did before. Pull down, extend those legs. Good. And come back in. You feel that in your abs?
Yes.
Don't forget to breathe. Exhale as you extend, squeezing, and then come back in. Now notice I'm here always to support these legs. And lengthen and extend. Hold. Bring them, hold them right there. Bring the hands up about mid-thigh. Bring them up to the block right there. Good. Now take the feet off my hand a centimeter. Oh. Now notice what he's doing. He's squeezing those heels because he was told last night to. But his toes keep wanting to pull in. Can you see it? And then come on down. Hands up. Feet down. Pull down for me with the arms one time. So pull down. Holding. I'm going to put the block back in. Come up, set the feet down. Just set them on down onto the bar. Good. I do that because if we let him come down, the odds are he'll pull the carriage all the way in, taking him past the 90 degrees. Now, I worked with him last night. I know he can do that. But if I didn't, if this was the first time I worked with him, I still wouldn't probably, you know, do that. I'd be as safe as possible.
Against the hip if you're not ready for it.
Well, no, I'm talking about when he puts his feet down here, there's not a lot of spring on here. So if he came in further than 90 degrees, it's not going to put a lot of wear and tear on it. It's not going to pop it out or anything like that, hopefully. But I'd rather be safe than sorry, right? As long as we keep him out of the hospital. All right. Did you feel those abs a little bit?
I felt the abs, yes. And I also noticed today I feel it anteriorly here, and it's where when I got infected, it hurt so much anteriorly. It didn't. That was where the pain was. I don't know if it's just that the muscles anteriorly were inflamed and really scarred in and irritated by the infection. But I feel that there, which is I don't think it's a bad thing, but I really feel it there.
So why is he feeling it there? So if he said that to you, what would be going through your head? Tell me what's going through your head, and then I'll tell you what's going through mine.
It was an area of weakness.
There's no area of weakness, very could be. Muscular-wise, what muscles are we looking at?
It's psoas, it's TFL, to help him, one, keep his legs elevated, but also assisting in extending his legs.
Okay, what else? You're right on track. It could be a weakness because he keeps not wanting to maintain his pelvis, so that area of his transverse abdominis could be a little bit weak because he keeps rotating through and allowing the rectus to take on when he was doing his foot series, so that could be in it. It's definitely some psoas work. Remember, that's the area where the inguinal ligament comes down and the psoas comes under and ties on. The TFL would be more on the outside of the thigh. Okay, because it's on the outside. It's basically from the crest of the ilium coming down into the IT band. So it's a little bit wide or internal for the TFL.
When he squeezes the heels and externally rotates his feet, is that?
Well, it's still the pain would be out here,
and
not right here. Okay, it could be a little bit of the sartorius, because the sartorius is going to do the external rotation also. So that muscle starts out there and crosses over, but that would be more on the thigh again. He's feeling it more on the abdominals. So I'd probably, huh?
Yeah.
It's basically where a hernia could be happening. So you're going to start paying attention. You might not want to do that too often. If I had, let's say, 4 sessions or 5 sessions with him and he's still complaining of that, I might actually say, hey, you might want to, you know, get that checked out a little bit. There could be something started there. Because that is his area where he had all the inflammation and infection and everything in there. You never know what could be in there. Again, so you just always take the safe route out. Let's put his hands on up one more time. Feet on up. Okay, I'm not even going to take the block out this time. I'm going to actually, well, the block stops the arms, so he's not coming to the full extension of his arms. See, that's as far down, and he's way over the shoulders a little bit. I'm going to actually just work on the coordination of his hips, and we're going to do single leg stretch with the arms. All right, so he's going to pull down and he's going to extend one leg. So pull down and extend this leg.
This leg?
Yeah. And come back up, bring back in. And then pull down and extend the other leg. And then come back up and bring back in. And pull down and extend the other leg. The key to this one is making sure that the opposite leg doesn't move. Then you know you have the hip differentiation that you're looking to stabilize. Because guess what? He's had a bad hip. He's going to try to use the strong hip to move the bad hip. Right? Thus, it's never going to get stronger. And lengthen. And back in. And lengthen. There. And back in. And I'm going to let go, and I want you to do it by yourself. So hold. There. Lengthen. One more in each. Lengthen. See that leg come in?
Yeah.
And lengthen. lengthen, and come in. And set your right foot down, or both feet down. And come on down. Now I'm going to spring him up to make sure that he can get off without that carriage moving.
I feel that in the quadratus again, like yesterday.
Oh, so he felt it in his quadratus. What's a good stretch for him? To stretch that quadratus. Huh?
Overhead.
Overhead, yeah. No, you can't do overhead. No. Turning the knees side to side really stretches that quadratus from that. You can't do that if the knee crosses the midline. But if you put a block in and you move both his hips, it's never crossing the midline.
Because both hips are going together.
Correct. And he loves this stretch.
Oh, it feels good.
Nice, right?
Really good.
And then come back. Now, if he did that and he said, I feel a little pain, we wouldn't do it. Pay attention to what your clients want. But the fact that we put this in here stops him from moving from side to side. It's actually his whole pelvis rotating. Thus, he's stretching that QL, right? Because his ribs are kind of fixed and his side is pulling and his other hip's lifting.
That's good.
And it was your right QL, right?
It was right. Correct.
And where was he having his pain? On his right inner ab. It's probably going to have something to do with the psoas, right? Now again, we just use this for ourselves. We're not diagnosing anything. We're not trying to put it out in place. We're not trying to be who we're not. We're just keeping in mind what we can do to kind of keep an eye on his exercise, right? So he's going to turn over on that side and he's going to sit himself on up. Hand across, remember this across?
Yeah.
And push. Notice that his leg really doesn't go beyond 90.